I love the patient relationship that we have, the holistic relationship that we develop with the patients. I like the way we get to see them very often, and I love working within a group of people. I think the best job satisfaction is when you have a patient coming over to you holding your hand and tells you how well you've done, how wonderful you've been, and what difference you made.
You've got to be focused, you've got to be alert, you've got to have good time management skills. You've got to think off the top of your head because the ward can change very quickly, can be quite calm, and then you're going to have a very acutely unwell patient that can arrive and you've got to adjust to that situation.
When I make a difference for the patient's life and when I see them going home and get well, that make a wonderful experience and feeling.
We all work together quite closely, we're very friendly, very supportive of one another, and there's a lot of experience on our ward. A lot of the nurses have been there quite some time and you gain an awful lot from them. We've got a fabulous team, so everyone helps one another.
I've had an immense amount of support from the unit. I had great mentors when I first started there. I had wonderful support and understanding from the sister and from the matron. And I was also able to go to a preceptorship course, which helped my transition from being a student nurse with very little responsibility to becoming a staff nurse. The
time I started, they really helped me to develop my career and to go far. When they given me a great opportunity to go to university, to go for a mentorship course and chemotherapy, which now I can able to give them to the patient. So I'm giving a holistic care for the patient because of that training.
Every year I've been able to have an opportunity to learn more, go on training courses with the skills, clinical skills. So every year I've always been able to diverse and do other things. I want to be able to specialise into being a renal transplant nurse. That's where I hope to get to.
They're very accommodating with shift patterns and we all do shifts. I do a long day a week and 3 short days. I start earlier than most in the mornings to finish early to get my children from school, so it works perfectly for me.
The role fits around my personal life very well. I've had 2 children. The ward's been very accommodating and given me flexible working hours. There have always an opportunity to go to them if I have any cause or concerns or upsets at home. So they've been very good.
We get a lot of study days throughout the year. They get a very good induction package when you're new to the ward anyway, to the trust. You can get involved in different parts of elements within the ward that's based solely around the speciality. So there's a lot of study involved in it if you want to do it, and you can progress up and up and up, you know, depending on what you want to do.
I think because Oxford University Hospitals work so closely with Brookes and also University of Oxford, there are much more different opportunities that we have as a staff.
Patients are very important. They come first. You want them to leave us that they come in but feeling much better, feeling that they've had good care, that they've had a good experience. And so you can leave with a smile on your face.
It's not just about the patient that we care for on our ward as well. We take into consideration the families. They're often a big part of that package of care.
It is really important what the patient, it's the feedback that they given it to us. They can be a teacher. They teach us. They're very appreciative what we do. I feel satisfied that they met the care that they need.
It's all about the patients. It's very important for us to provide them with excellent care. We look after their physical as well as psychological well-being, and we work in very closely with multi-professional team to trying to achieve the excellent patient care.
The best aspect of my job is feeling happy. I feel very happy in where I'm working within the Renal Directorate.